Welcome to the comprehensive Primary Care Plus Quality and Health IT on-demand webinar. Today's agenda will walk through a welcome, quality goals and requirements, health IT requirements, and a summary and support section. Today's CMS presenters are Perry Payne, the CPC Plus Quality Lead, and Lisa Bari, the CPC Plus Health IT Lead. Perry, you can begin the presentation.
Okay, for the quality portion of this presentation, we're going to start off by talking about the CPC Plus Quality Goals, and then we're going to spend a little time talking about the performance-based incentive payment that results from performing well on the various measures of quality that we have. Then we'll walk through the various ways that we're measuring quality: electronic clinical quality measures, the patient experience of care measure, utilization measures, and the patient-reported outcome performance measure. And for that measure, it's not tied to payment, as we'll mention later, but we will be working to develop that measure during the model. And then finally, I'll end by talking about dual participation in the Medicare Shared Savings Program for those of you who are in ACOs and also in CPC Plus. Okay, first our goals and requirements. As most of you know, what we're seeking to do here is to improve quality of care and improve patients' health and lower healthcare expenditures, the triple aim. So we're looking to reward quality improvements of various types, and we're measuring clinical quality improvement using our electronic clinical quality measures, and we'll talk later about what those are and the process of selecting those. And we're also looking at patient experience of care because we think that in a patient-centered medical home, the perception of care that is being received by patients is very important, and we need some way to measure that. And we're also looking at utilization. One of our main goals is to decrease unnecessary utilization of care, and so we'll be assessing utilization of care in this model. And then finally, for track 2 only, we're going to be working to develop a patient-reported outcome performance measure. And the reason for this is that there really is a dearth of these type of measures for primary care, and we think that we have a really nice opportunity here to work on developing this measure with data that we can gather from the patients that you all are seeing, and hopefully that measure will be utilized in the future for assessing quality from the perspective of the patient. So first, the performance-based incentive payment. So one question is, well, why are you doing all of these measurements? Why are you engaging in the electronic clinical quality measure, utilization measurement, and so on? Well, we're engaging in those measures not only to achieve the goal of our programs, our model here, but also to determine how we should reward you. So the reward, which is the performance-based incentive payment, is broken into different categories. There's a quality category and a utilization category. Essentially, half of the reward is attached to each. And depending on which track you're in, the award amount will vary. So you can see the track 1 amounts, $1.25 for quality and utilization, and track 2, $2 for quality and utilization. For the quality portion of the performance-based incentive payment, we look at the electronic clinical quality measures, and we also look at patient experience of care using something called the CAT survey. These are all measured at the practice level. For utilization, we look at inpatient admissions and ED visits, and again, those are also measured at the practice level. And more details will be forthcoming regarding the methodology that we use and also the benchmarks. I'll just say a little more about the PBIP here, but as I say, the more details will be forthcoming throughout the model. So in order to be eligible for the PBIP, you do need to report the required electronic clinical quality measures. We required you to report 9 of those out of a set of 14 that we offer to you. And then you also have to participate in the patient experience of care survey. That doesn't require much of you because CMS will be conducting that survey, so that will happen for all of the practices. And then also, we will be then looking at a certain minimum threshold of performance in order to decide whether or not you are going to be eligible for the performance-based incentive payment. So we have minimum thresholds, and then we also have a maximum threshold, a point at which you are able to share all of the payment. The minimum threshold decides if you can share any of the payment. Maximum threshold is where we decide that you can share all of the payment. So the way this works is that at the beginning of the model, based on our assessment of your number of patients and that we assign to you, something called attribution, will determine what your initial payment should be. And you receive that payment up front in year one of the model. And then the following year, in 2018, we'll take all of the quality measure data that we have from your practice, and we'll use that to determine how we should adjust your next payment. So we'll reconcile the payment. And so if you're performing at the highest level where you can receive 100% of the payment, then you simply receive all of that payment again. If you're performing lower, then you receive less of the payment. And so the general idea is to incentivize you to perform well on these various quality measures. And again, more will be forthcoming on how exactly what the targets are, what the thresholds are, and how the various amounts of money are attached to those different levels of performance. Okay, now let's talk some more about electronic clinical quality measures. So for the electronic clinical quality measures, we have a set of measures that we provided in the welcome packet. We'll also share those here. And we're requiring that you report 9 of the 14 measures that are listed. There's a link here to the measure set also in this presentation. You have to select at least 2 of the 3 outcome measures that are available, at least 2 of the 4 complex care measures that are available, and then any 5 of the remaining measures. And so that makes up a total of 9 measures. We strongly encourage you to obtain all of the measures in your EHR, but you're only required to report 9. The reason we suggest that you obtain all 14 is because we predict that there are likely to be changes during the model to these measures, and we want to make sure that that you're able to make adjustments and adapt to those changes that may occur. So, for example, if there's a change in clinical guidelines, then, and we decide that we're not going to use one of the measures, but there are still others available, you're able to select one of the other measures. So that adaptability we found from CPC is very important because so many changes occur in this realm, as you can imagine, because we're constantly learning more and more about what good quality of care means. So we want to encourage you and strongly encourage you to obtain all 14 of these measures for your EHR so that you are adaptable moving forward throughout the 5 years of the model. And then tied into our primary care functions, the transformation that you're going to be doing in your practice, you are required to select at least 3 of the eCQMs for your quality improvement efforts in your practice. And you might wonder, well, why are you only requiring me to select 3 for quality improvement efforts, but we have to report 9? Well, the idea is that throughout the model, you can change those 3 that you're focusing on. What we're trying to do is encourage practices to pick at least 3, because what we found from our experience and from the clinical advising that we've received from clinicians who, primary care clinicians who help us with this model, is that more than 3 gets to be a bit much for practices. So focusing on 3 for quality improvement efforts seems to make sense, and you report those to us. You give us some sense of what you're doing on those measures. You'll be working with your people in the region who are going to be assisting you, our contractors who will be working with you on those various quality improvement efforts. So you select 3, but you can change those 3 as you move forward. So we definitely expect that those will evolve over time. All right, so when you report the eCQMs to us, we require that you report all components, all data elements of the eCQM. So the numerator, denominator, and if there are any exclusions and exceptions, you also report those. We found in CPC that there are times when practices will report this information, but then give us the wrong the incorrect performance rate. So we have the performance rate calculation here just to remind you how this calculation is done. And we suggest that throughout the year you take a look at your EHR, try to generate a report, and make sure that the performance rate you see in your EHR is matching the basic calculation of performance rate so that you're clear that everything is being calculated appropriately, so that once you send us the data, you'll be confident that the data represents the work that you're doing. So the performance period for reporting the eCQMs is January 1, 2017 to December 31st, 2017. So that's the period where you're collecting all of the data, right? And then after that, you're going to provide us with that data. So that's the reporting period. And that's from January 1st, 2018 to February 28th, 2018. These dates may change slightly, but this is the general time frame during which you will report this data to us. There are two ways to report the data. You can do it through what we call attestation. That means you go into our web portal called the CPC Plus Practice Portal, and you simply type in the data from your report and provide it to us, or you can use something, an electronic submission method with a file called QRDA3, and your vendor should be familiar with this file and know all of the requirements for submitting data utilizing this file. And this will be done through the MIPS portal, and more details are forthcoming in terms of how the MIPS portal will be working and how you would submit that data to us. But most vendors are aware of this, and you can talk with them about this method if you decide to go down this route. When you do report the information to us, we ask that you save a hard copy, and you'll also be required to upload a copy of your report to the practice portal. Now, this report might not be one document. It might be a couple of documents in order to cover all of the requirements that we have for that report. But the important part is that you simply put it all together and upload it. You may even have a set of different screenshots. You might have PDF, might be a Word file. There are a lot of different ways that this might look, but the idea is that you collect all of the information required and upload that too. Okay, and just finally, just as a reminder, the performance-based incentive payment is adjusted based on your performance on the eCQMs.
Great, and so I'm jumping in here to talk about the health IT requirements as they relate to eCQM reporting. We have different requirements for both tracks 1 and 2, but all practices must use certified EHR technology and, in some cases, certified health IT to perform these specific functions around eCQM reporting throughout all of the 5 CPC Plus performance periods of the 5 years. We strongly, strongly recommend that you contact your health IT vendor or your EHR vendor now to ensure that they will be able to meet these requirements, which are detailed in the RFA and on our website. So first of all, starting from the left, by January 1st, 2017, both tracks 1 and 2 must maintain 2014 or 2015 edition health IT certified criteria. They must also ensure that their health IT is capable of reporting CPC Plus eCQMs at the practice site level, which is a combination of TIN, NPI, and your physical address. By January 1st, 2018, both tracks 1 and 2 must adopt or maintain 2015 edition certified health IT, and they must also ensure that their eCQM practice site report is made using the health IT meeting the 2015 edition C4 criterion for filtering. And this again is filtering by practice site and a combination of TIN and NPI. Later on the right, you'll see by January 1st, 2019, there are different requirements for track 2 practices. We'll talk about those later, and they'll also be dealt with later on in the year.
Okay, so here is the set of the 14 measures that are required. This is half of the measure set, and on the next slide, you'll see the rest of them. So looking at the top part of this slide, you'll see that you have to select 2 of these outcome measures, and they're all listed here. They're also in the welcome packet. They're also on our public-facing website for CPC Plus. So these measures are readily available to you in a variety in a number of different locations. So then you have to select 2 of the complex measures. That's what you see here at the bottom of the slide. And then select 5 from the remaining measures, either these or any of the remaining measures from the complex care and outcome measures. And again, here's a link for getting a list of the eCQMs. They're readily available at any time. So when you submit an eCQM report to us, here are the various factors or various components of the report that we would like to see from you. So we want to see your practice site location, your name, address, or CPC plus ID, CPC plus TIN and NPI, so the NPI is associated with that TIN, the health IT vendor information, and for each eCQM, we want to see the CMS ID and version, and a stated numerator, denominator, exclusions if applicable, and exceptions if applicable, and the performance rates. So again, your report generated from your EHR is going to vary by vendor, and so your reports might not necessarily have all of this information in one single report, but we think that you are able to acquire all of this information from your EHR. So there may be a series, you may have screenshots, you may have a PDF report, you may have a couple of things that you just take and put together and submit to us, and that will be the report information that you save and also that you upload to our practice portal. And here are some resources related to eCQMs that we think are very useful for you, that explain the various eCQMs and their specifications and so on. They give you some tips on how to go about selecting appropriate quality measures for your practice. And we're available for questions at any time regarding those. Now I'm going to talk about patient experience of care and utilization measures. So for patient experience of care, we're using something called the CAP survey. It's the Consumer Assessment of Healthcare Providers and Systems survey. We're going to be sampling CPC Plus patients. We're going to be sampling Medicare beneficiaries and other patients. So we're looking across all payers because, as you know, CPC Plus is a multi-payer initiative. So we're going to be sampling the experience of care received by all of your patients, not just those who are Medicare beneficiaries. So the important aspect of the survey from your perspective is whether or not you have to pay for it. And you don't. You don't have to pay for this. We pay for this. We have a contractor that will be working on performing the CAP survey. The second question you should ask is, well, okay, since you guys are paying for it, what do I have to do? Is there anything I have to do here? And what you have to do is provide us with a roster of your patients so that we can then take that roster and sample the patients. And we'll be providing more details as we move closer to conducting the CAP survey regarding what should be in that roster and what we're looking for in terms of a list of your active patients. So with regards to utilization measures, we have 2 utilization measures that will be used throughout the first year of CPC Plus. And these utilization measures are being calculated at the practice level. They are an inpatient hospital utilization measure and an emergency department utilization measure. We are calculating these measures using claims, so there's nothing for you to do here. There's no reporting requirement at all. We assess those for you and make a determination of whether or not you are meeting a certain standard. Now, on your side, you do want to pay attention to the data feedback reports that we give to you throughout the model so that you can monitor how you're doing on utilization. And of course, you'll be working with the learning team that we have for CPC Plus on addressing, on coming up with ways to decrease utilization. All right, and so the PBIP, the performance-based incentive payment, is adjusted based on the utilization measures and also based on the patient experience of care measures. And finally, the patient-reported outcome-based performance measure. This is an experimental aspect of the quality measurement that we're doing. So we're going to be working with only Track 2 practices on developing this performance measure. So we're going to be utilizing a particular patient-reported outcome measure throughout the early years of the model, probably year 1 through 3, We'll be giving you more details on this as we move forward, but roughly we'll be utilizing a tool to survey some of your patients and then feeding that information back to your practice so that you can utilize this to inform patient care. Let's say, for example, we're utilizing a measure that is related to overall, let's say we're using a measure related to depression. Then we would gather information from the patients and then utilizing a validated, reliable measure, we would feed that data back to your practice, and then you would respond to it based on what the score is on that measure. And again, we'll be working with you in the coming years on this effort, and you will hear more details on how this will proceed moving forward. And in fact, we're likely to ask for your input, maybe a sampling of practices we'll probably work with and gather some input on what these measures should be. This will not affect your your performance-based incentive payment. This is going to simply be a measure that we create and generate that we hope can be used in the future for primary care for better understanding of how patients are perceiving the quality of care they're receiving. And finally, dual participation in the Medicare Shared Savings Program and CPC Plus. So for those of you who are in ACOs that are in the Medicare Shared Savings Program and also in CPC Plus, you will not be eligible for the PBIP. That doesn't mean you don't have to worry about the reporting required for CPC Plus. In fact, you do have to worry about it. You do have to report the quality data required by us and by MSSP. Both models have their own requirements, and both are assessing changes in your practices or changes in the ACO, sort of a larger group of clinicians there. So we both are requiring that you submit the data that each program is requesting so that we can assess your progress in the model. You will be eligible for shared savings through the Medicare Shared Savings Program, but you will not be eligible for the performance-based incentive payment simply because you're already in a program that provides you with an incentive payment, and we are not allowed to double pay you for similar types of work. So that's why we're not able to provide the incentive payment and the shared savings payment from two models. All right. So here are some additional resources related to CAPS, utilization measures, and the patient-reported outcome performance measures. And we think these will be useful for your practice as you seek to understand these various quality measures, and we're always available for questions also.
Great, thanks, Perry. We'll move on to the health IT requirements for CPC Plus. So first of all, I'll start off with this health IT checklist for both tracks 1 and 2. First of all, please review the health IT requirements for your track very carefully at our website. Second, talk with your health IT vendors to ensure that your practice will actually meet these requirements. It's very important that you have had this discussion with them, whether you have a vendor letter of support for a track 2 practice or not. If you're planning on switching EHRs in the next year, you must notify CMS in the practice portal for CPC Plus. You will get access to the practice portal shortly. CPC Plus support will then follow up with you directly. So please contact your current and your new health IT vendor immediately to plan for this switch and to ensure that you remain eligible for CPC Plus. This is very important if you have any plans to switch EHRs in the near future. On to the key health IT requirements for both tracks. Practices are required to ensure that the capability exists to generate a CPC Plus practice site report for the entire 12-month measurement period, as we discussed earlier, from their certified EHR technology or certified health IT. An important note here is that some EHRs do not support this practice site reporting that is required in CPC Plus. In this case, CPC Plus practices were required to adopt an additional certified health IT, such as a specialty registry, to meet this basic requirement. If you have questions about this, please contact CPC Plus support immediately if you're not sure that your EHR can meet this requirement. There are also enhanced health IT requirements for Track 2 practices only. These are not certified health IT functions. So they were things that will be developed in the future with your health IT vendors who have signed and delivered to us a vendor letter of support. Track 2 practices are required to use the following advanced health IT functions in the future. They must risk stratify patient populations and identify and flag patients with complex needs. They must assess psychosocial needs and inventory resources for those needs. They must ultimately track patient-reported outcomes, as Perry discussed. They must impanel patients to the practice site care team. They must be able to establish a care plan in future based on a specific certification. And later on, there's an option for developing care delivery and care touch documentation resources. Track 2 practices should be working with their health IT vendor or vendors to access these functions and develop them in the future. We anticipate that all of these requirements will be completed between the first 6 to 24 months after CPC startup, so essentially before January 1st, 2019. More to come on all of these topics. Switching EHRs for Tracks 1 and 2. As I mentioned earlier, it is very, very important that you notify CMS of any plans to switch EHRs in the CPC Plus practice portal. Our support will follow up with you directly. This notice must occur at least 3 months prior to the switch. If the practice fails to give notice in a timely manner and you're not able to report the required eCQM data, the practice may become ineligible for continued participation in CPC Plus. It is very important that we know about this and that we have a plan together to make sure you can report. If you cannot report 12 months of continuous data due to the EHR switch, the practice must do one of the following in order of preference. Number 1, submit at least 9 months of attested eCQM reports results into the CPC Plus practice portal during the subsequent submission period. You must, second, if you can't do that, submit a plan for a manual compilation of eCQM data from both certified EHR technology and health IT for CMS approval. And finally, the last option is to manually compile eCQM data from your certified health IT. However, all of these things must be done with advanced approval from CMS. We must first know in advance and work with you on a plan to make this happen. So please do not assume that it's okay to do this if you don't already have access to 12 months of continuous data. Contact CMS support if you're planning on switching EHRs now. And finally, we have a list of useful health IT resources for CPC Plus practices. There is a health IT playbook put out by our colleagues at the Office of the National Coordinator for Health IT. There is a white paper on EHR contracts. There is the list of all of our health IT and Track 2 advanced health IT requirements. And finally, we have forms and templates. For example, the vendor letter of support and the list of current global vendor letters of support of health IT vendors that have already said that they want to support CPC Plus practices. So we encourage you to check out all of these resources. All right, and for the final section on summary and support, here's a quick view of the timeline for both Tracks 1 and 2. First of all, we have the Year 1 performance period, which is the 2017 calendar year. Then there is the Year 1 reporting period, which is from January 1st, 2018 to February 28th, 2018. That's the period of time in which you can report on the Year 1 performance period of 2017. On January 1st, 2018, the Year 2 performance period begins. As a reminder, for the Year 1 performance period, you must maintain 2014 or 2015 edition Health IT. And for Year 2, you must adopt or maintain 2015 edition Health IT based on the certification criteria for 2015 edition. So please make sure that you're planning on that with your vendors and you're ready to go. Those are the timelines for Tracks 1 and 2 for the first year and the performance period. Finally, here are some tips for a successful first year. First one, select 9 of 14 eCQMs. Make certain that your EHR meets the ONC certification and CPC Plus Health IT requirements and reporting requirements. ensure that your certified EHR technology or certified health IT can produce a CPC Plus practice site eCQM report for the entire 12-month measurement period. Talk with your health IT vendor now about QRDA 3 reporting method if you're considering this option. Ask your health IT vendor for a copy of your practice's annual eCQM results. It's very important that you have these available and that you upload them when you submit your reporting. Notify CMS at least 3 months in advance of an EHR switch. It's not too early to notify us now if you're planning on switching EHRs in 2017. And finally, contact CPC Plus support if you have any questions at all about any of the material in this presentation, cpcplus@telegen.com. And finally, later on in this presentation, you'll see many of the key quality terms that we've talked about defined here. We encourage you to look through these and to get any questions answered you have. Hopefully this will help. And we're here to help. This is how you contact us. cpcplus@telegen.com. You can call us at 1-888-372-3280. You can contact us through the practice portal when you get access to it. Please reach out. We're happy to answer any questions. That's it.
Thank you.